大家都晚上好。到了最后的演讲，我要感谢 INC 的支持。你们 INC 的人选了非常漂亮和非常高的地方为这个分会。这个上海中心大厦给了我非常深刻的印象。So I said that this tall building gave me a very deep impression, especially when I look down from the window. So my today's topic is recent strategies in treating surgically brainstem cavernous malformations. And I'm doing this for almost 30 years. Actually, brainstem itself, I started in '86. And since then, of course, as everybody, I tried to improve my technique, but not only the surgical technique, but also the understanding for this pathology, the selection of patients, and the surgical strategies, and so on, which, of course, over the years may change, especially also the selection of patients. When you're young, you might have more tendency to do the surgery, and now I have the tendency to have good results and not focusing on the number of patients. Now, the anatomy of the brainstem consists of, for us, of two parts. One is the topographic anatomy from outside, which we should have in our imagination, and the other one is the intrinsic anatomy, not only the nuclei and the long tract pathways, the short pathways between the segments, but also these blood vessels, as you can see, and the segmentation of these the vessels we should have at least some idea about. And then we have this classification or this anatomical distribution of medulla, pons, and midbrain. Of course, these structures are different one from the other, but in fact, in the nature, there is no limitation. Yeah, so the cavernous malformations may extend from one to the other. Another point is that we may have, is this visible? Yes. One cavernous malformation may be simply bulging out, and of course this one is a totally different challenge, or let's say this one is a totally different challenge from this one to remove, and this one needs, of course, something thoughtful, because the malformation is on both sides. We cannot remove everything, including the cerebellar part, in one surgery, so it may need stage surgery and so on. So all these points play a role. So correct indication for surgery, timing for surgery is important, especially related to recent hemorrhage. And once we have established the indication, I say, okay, this is a surgical case, then we must find the optical surgical approach. And in many instances, we have 2 or 3 possibilities to how to approach, from anteriorly, from lateral, from posterior, wherever. And they are not all the same. So we can remove, but there are advantages and disadvantages, which also we should quite well know. And then this meticulous surgical technique will be different from cavernoma to cavernoma. Some of them have a shape like we can see here, yeah, with the arterial supply, and these veins actually are part of an associated venous malformation, sometimes small, sometimes very big. And then there might be a solid capsule, and this capsule again has its own blood vessels and so on. So all these factors play a role.